Hello, hello, good evening, coders. How are you tonight? Talk to me. Who's all here? I want to see I want to see you make some noise here in the chat. Hi, Miss Sarmi. How are you? Hello, Patricia. I'm so glad you're here tonight. Yes, it's been really beautiful over here in California, hasn't it, Patricia? But a little bit cold over where I'm at because the sun was not out today. So a little bummed about that. Hi, Francine. So glad to see you here. Hi, Tiffany. Hi, Deborah. Hey, all right. So I'm going to go ahead and get started with our time scenarios. And Miss Josie, can you read the first one for us, please? And I think we only need maybe 30 seconds on this one.
Okay. We're going to look at the answers first, coders. A is location, severity, and duration. B, location, quality, and duration. C, quality, severity, and timing. D, quality, duration, and timing. Which elements of the HPI are met in this statement? Patient complains of headache and blurry vision for the past 3 days. You have 30 seconds and you may begin now. Okay, coders, get your answers in. I'm seeing some A's and some B's and some C's. We're a little bit split. I see more A's, Miss Tracy.
Okay, thank you so much, Miss Josie. All right, I see you guys still putting answers in, so give you just a few more seconds. And looks like we are very split on this one. Okay. So yeah, I see every single answer here, A, B, C, and D. So I think this is a great one to start off with. Okay. All right, so let's go ahead and take a peek at what's going on here. So first of all, I'm going to highlight my keywords here. So it's talking about which elements of HPI are met in the statement. So what are we talking about when it says HPI? What is that? What is it talking about there? What does that stand for? Yes, Linda, you got it. Yes, Sarmi, that's right. Yes, Elaine. Great job, guys. Okay, so that's our history of present illness. So we're looking for headache, blurry vision, and 3 days. So it's telling us, it's giving us a little bit of description of what's going on here with this patient. So our answer here is B, location, quality, and duration. What I'm going to do is I'm going to pull out the history of present illness, or the HPI portion in my history table. And basically on this, we have to answer the following questions. Location, do we know where on the body this has taken place? And the answer is yes, because headache, we know that that's in the head. So we do know that we would be able to mark that as the location on the body, okay? Next, blurry vision. That falls under number 2 here, which is quality. It's describing the illness, and it tells you, is it aching, throbbing, burning, sharp, piercing? Well, it's saying that the vision is blurry. So it's describing the vision here, okay? So that would fall under quality, okay? Severity, we don't have that. It doesn't say it. Duration here, it does tell us because it says for the past 3 days. So how long has this problem been occurring? Well, for the last 3 days, okay? Doesn't tell us when it occurs, under what circumstances, doesn't give us any modifying factors of what makes it better or worse. It doesn't tell us that if the patient's having any other signs and symptoms. So basically for this one, headache is location, blurry vision is the quality, and duration, 3 days, okay? All right, so our answer is B, and let me know if you got it. Just simply type "got it" in the chat for the ones who it's your first time in a group study. I just want to make sure that everybody got it. Okay, great, great, great. All right, awesome. All right, I see got it's in the chat. So we're going to go ahead and move on to the next one. And Miss Kelly, can you read that one for us, please?
I sure can. All righty. This is a ICD-10. So we're going to start with the answers. A, F 50.00, E 86.0, B, R 63.0, E 86.0, C, F 50.00, E 86.0, F 02.80, D, F 02.80, R 63.0, E 86.0. Miss Murphy, an 83-year-old woman, is being admitted for dehydration and anorexia. The probable cause is dementia. She was brought in by her son, who is visiting from out of town. Her son would take her from our office to Memorial Hospital. The gerontology unit at the hospital will evaluate her mental condition tomorrow after she is stabilized. How would you code the diagnosis? And you have 2 minutes starting now. Okay, that's time, coders.
All right, thank you, Miss Kelly. All right, still see some answers coming in, so I'm just going to kind of hang out in the chat for a few more seconds and just let your answers come in. I'm just going to take a peek at what everyone else is saying here. All right, I'm liking what I'm seeing here. We have a little bit of a division on this one as well, but that's okay. We're going to walk through it. There's kind of a lot of stuff going on in this one. Great catch on that, Karina. That's okay, Gessa. If you're waiting for, if you have older manuals, you can use those while you're waiting for your new ones to come in. Okay, give you just a few more seconds, about 10 more seconds, and then we'll go ahead and take a look at this. Okay. Okay, so let's look. So first of all, we're going to go to our keywords here. And I have an 83-year-old admitted for dehydration and anorexia. Okay, our answer is B. All right, and I did see a lot of you chose B, but I did see a mixture of some of the other answers as well, and that's okay. First of all, let's go ahead and look at A, F50.00. Okay, that first listed code in A, and it's also first listed in C. So our category F50 is for eating disorders. And if we go down to F50.00, this is for anorexia nervosa unspecified. Okay, so that is not our code. Can anybody tell me why? Great to hear that, Angela. Love learning moments. Okay. That's right. That's right, Patricia. Yes. That's right, Gessa. Yes, you guys are getting this. So basically we see anorexia in our scenario, but F50.00 is for anorexia nervosa. That's actually an eating disorder from the F section for mental and psychological disorders. And if you look right here, pay attention to these excludes one and excludes two notes. So what does excludes one mean? Going back, take you back to ICD-10, but we're going to get started with E&M just right after this one. But you know, I always like to throw in a ICD-10 one here just to kind of keep us fresh on that. Yes, it cannot be coded here, okay? That's right. So these two cannot be coded together, and it's saying that it excludes anorexia not otherwise specified. And in our scenario, it does not specify. The doctor does not say that this patient has the eating disorder anorexia nervosa. It just says anorexia, okay, or otherwise known as anorexia, not otherwise specified, because he's not specifying the exact type of anorexia, right? So that means we can't code F50.00, okay? So based off that excludes one note, we are going to get rid of answer A and also answer C, okay? Now let's go down to R63.0 here, and that's our anorexia code, okay? Which is, or otherwise just loss of appetite. And it could be for a variety of reasons, but it says this patient could have dementia. So maybe the patient may just be forgetting to eat. Not that they have an eating disorder. She just might be forgetting to eat because she has dementia. But that was not definitive yet. But the doctor's just thinking maybe that's what it is. But she does definitely have anorexia. So R63.0 is for anorexia. I see that in answer B, first listed code, and second listed code in answer D. Okay, so I know that's great. We're on the right track there. Okay, now F02.80, the first code there in answer D, that is for dementia. Why are we not coding F02.80? Why would that not be our code? Yes. Pay attention to those keywords, and it's saying probable, okay? Probable. We do not code the probable diagnosis, so therefore F02.80 is going to be incorrect, all right? So we are just going to code the symptoms here, okay? Because a definitive diagnosis has not been established. So our symptoms are going to be anorexia, and also don't forget the hydration, because also she has dehydration, okay? So AE 86.0 is our code, our code for dehydration, okay? So if you got it, let me know you got it. If you didn't get it, but you understand it now, let me know, say aha or something. So that way I know that you understand it now. Yes, guess that's correct. Highest level of doctor certainty and specificity, our CNS. Great job. Perfect. All right. Great, Angela. All right, Haji, Tina, awesome, awesome, Elaine. Okay, all right, so let's move on to our next one. And Miss Josie, can you do us the honors of reading this for us?
I sure will, Miss Tracy, and we're going to look at the answers first. So A is 99285, B 99284, C 99221, and D 99222. Patient was in the ER complaining of constipation with nausea and vomiting when taking Zovirax for his herpes zoster and Percocet for pain. His primary care physician came to the ER and admitted him to the hospital for intravenous therapy and management of this problem. His physician documented a detailed history, comprehensive examination, and a medical decision-making of moderate complexity, which E&M services reported. And we're going to give you 2 minutes and 30 seconds, and you may begin now. How are you doing, coders? Everybody get their answers in? Okay, I see we're a little bit split on this one. We've got C's and D's and B's, Miss Tracy.
Okay, awesome. Okay, thank you, Miss Josie. Okay, so get your answers in. I'm just kind of scrolling and seeing what everybody's saying here. I think this is going to be another teachable moment as well, because we are very, very split on this one. And I only see a handful that got this answer correct, but that's okay. That's why we're here. We're here to learn. And if you learn something from this, that is what truly matters. That's what I always say, and it's the truth, okay? That we're here to learn, and I want you to keep coming back week after week, and you're going to see yourselves getting stronger. So this is great. Yes, yes, yes. Wait for it, Miss Cheryl. Okay, so first of all, what can we observe from our answers? What do you guys see when we look at our answers here? What's the first thing that you observe or you notice here? Okay, I like that, Jeannie. Great job. Hi, Miss Jeannie. Okay, all right. So yes, Deborah, I like that. So the first thing that I see here is that A and B are from the same location, you know, and I can tell that by the codes here. So we see 99284, 99285, okay? So that's typically from the same location when they're really close together like that. And in C and D, same thing. We have 99221 and 22, okay? So the A and B is from the ER, and C and D are from inpatient hospital, okay? All right, those are some things we got to think about going into this, into these keywords, okay? So let's go to our scenario and highlight the keywords. We have ER, okay? I know that I have ER codes here, so that looks good. We have ER again. We have admitted, we have admitted to the hospital. Okay, now I have two locations that I'm dealing with. And here's my HIM, detailed history, comprehensive exam, medical decision-making of moderate complexity. And I want to take a moment to just say that when we're going and we're highlighting our keywords, or you're underlining your keywords, or just pulling those keywords out, kind of slim down what you're pulling out as a keyword, okay? For E&M, we only really need to know the location. If you have the HIM, you definitely, sometimes you won't use the HIM, but we always want to get in the habit of knowing what the HIM is. So if you have the full HIM, you want to document that. You know, the location, the doctor that you're coding for, and things like that. But we don't need to know unless we're doing auditing or something. That's a whole different thing, because that does require a lot of keywords. But if we're not doing an auditing scenario, we don't need like the Zovirax, we don't need intravenous therapy and management, we don't need any of that. Just the location. For this scenario, we just need the location that we're dealing with, which we have ER and hospital, and our HIM, okay? And that's all I'm going to really need to solve this scenario, okay? So with that being said, I'm going to document my HIM, and that is DCM, all right? Now, what do I need to do? What's my next step? Oops, sorry. I revealed the answer, but what's my next step? And our answer is C. Yeah, I keep losing my question box. So what tool is going to be useful here? Because remember at the beginning of class, I said 1 E&M code per doctor per day, except for PICS. So what do we do? Yes, yes, Deborah, you got it. Sarmi. We would pull out, if you don't know which one we're going to code here, document that. We're going to pull out our location chart, okay? Because again, as you see here, we have 2 ER visits and 2 inpatient hospital visits. So we pull out our location chart and we see where these rank, because we're only going to be able to code one of them unless they are a PICS, and they are not a PICS, okay? And obviously it's not showing 2 codes here together anyways, so I don't have to worry about that in this scenario. But basically, I'm going to look and see where my emergency room visit is. It ranks number 6. And then I'm going to look where my hospital ranks, and that ranks number 3. So our hospital here is higher than our emergency room visit. So therefore, that means we're coding for the hospital and not the emergency department. Okay, so let me know if you guys are following me so far on that before I move on. Awesome, Gessa, I'm so glad. And this is located in your TTT manual, just in case you're wondering. Okay, so everybody's following me. All right. Okay, I don't see any violent reactions, so I think we're good. Okay, so that means we're going to throw out those ER visits and we're going to code for the hospital, okay? So that means I can eliminate those two answers, the A and B, okay? So we just have what's left. And now what I need to do for these two that are left, I need to figure out the HIM. I need to figure out what the HIM is for 99221 and 222. So just look in your book. Sometimes you'll see it listed like this, D/C, D/C, S/L. That just means it could be either or, okay? For this history, it could either be a detailed or comprehensive. Our exam could be either detailed or comprehensive, and the MDM could either be straightforward or low, okay? And then for 99222, the HIM is CCM. Okay, so now that we have that, we have to determine which one of these are eligible. So tell me, coders, which codes are eligible here between C and D? Yes, Jeannie. Yes, Patricia. Okay. I'm just talking about eligible. Okay, yes, Cheryl. So I'm seeing our regular coders, our regular attendees of group study. They know the deal on this. So basically, what does it mean when I say eligible? I'm not saying which one is correct. I'm just saying which one of these two that we have here are eligible. Is C eligible? Is D eligible? Are they both eligible? Yes, Francine. That's right, Jeannie. Yes, Tiffany. Yes, Karina. So when I say which ones are eligible, it just means which one has at least one matching component. Because in order for us to even look at that code, it has to have at least one matching component, okay? Meaning one of the components in the HIM has to match. So history, exam, or MDM, or a combination of all three, okay? If it doesn't match any of those components, we can throw out that code right away. We don't have to look at it, okay? But if it's eligible, then we do have to take a look at it, okay? So here, the ones that are eligible, so C is eligible based on the history. Our history matches there because this could be either detailed or comprehensive. So our history does match. Our exam matches. We have a comprehensive exam. And the MDM doesn't match, but that's okay. It's eligible just based off those first two. And then in answer D, the exam matches. Okay, we have a comprehensive, and then the medical decision making matches. So that just means that both those codes are eligible. Okay, so I'm going to check mark those. That means I got to take a closer look. So now that both of those are eligible, how do we determine which one is going to be our code? Let me know in the chat. That's right, Karina. What is going to be useful here to use for this scenario? We need a couple different tools here. Yes, Tina, you got it. So the song. So if you go back to the song, it says new or initial 3 out of 3, or is it subsequent established 2 out of 3? So it just depends on which part of the song we're going to follow. Okay, for these codes, 99221 and 99222, is that a 2 out of 3 or a 3 out of 3? Yes, these initial hospitals, yes, you got it, Tina. They're 3 out of 3. So we're going to follow the first part of that song, which says new or initial, 3 out of 3. If you select the lowest eligible, correct you will be. So that basically takes guesswork out of it. It tells us if it's 3 out of 3, in this case, these are, we would take the lowest eligible. They're both eligible. We just determined that. Our lowest eligible is answer C. Okay? So that means we can throw out D. All right, talk to me. Let me know if we got that. Does that make sense? Just want to make sure that we understand this one before moving on. So we had to do a couple different things here. We had to figure out the location, and we did that with this location chart, and then also we had to level, okay? And we did that by utilizing that song. It really does help. Okay. All right, looks like we got it. Okay, I don't see any questions or anyone asking me to clarify anything. So it looks like we're good to move on. So I'm going to go to our next one, if you don't mind. We'll try to get through as many as we can tonight. All right, so Miss Kelly, do you mind reading this one for us? Are you there, Miss Kelly? I don't think we can hear you.
Oh, sorry.
Oh, there you go. I saw you off mute, and I was like, okay, you're probably trying to talk, but I just couldn't hear you.
Yeah, I'm sorry, I had my microphone muted as well. That's my fault.
Oh, that's
Okay.
okay.
A 99221, B 99231, C 99238, D 99283. A 33-year-old male was admitted to the hospital on 12/17 from the ER following a motor vehicle accident. His spleen was severely damaged and a splenectomy was performed. The patient is being discharged from the hospital on 12/20. During his hospitalization, the patient experienced pain and shortness of breath, but with an antibiotic regimen of Levaquin, he improved. The attending provider performed a final examination and reviewed the chest X-ray, revealing possible infiltrates, and a CT of the abdomen ruled out any abscesses. He was given a prescription of Zosyn. The patient was told to follow up with his PCP or return to the ER for any pain or bleeding. The provider spent 20 minutes on the date of discharge. What CPT code is reported for the 12/20 visit? And you have 2.5 minutes starting now. Okay, that's time, voters. And Miss Tracy, I like these answers.
I agree, Miss Kelly. On fire. Thank you, Miss Kelly. Okay, everyone. Yes, great job. Great job. Okay, so let me hide my question box here so I can see my screen. All right, so first of all, what I want to do is I want to look at my answers first, okay? So when I look at my answers, what do I see? What do you guys tell me what you see when you look at these answers? Let's see. Yeah, pretty much, Katina. Um, okay. So looking at these codes, looking at these codes here, what can you observe? Yes, Patricia, I like that. So these are all, basically, when I look at these codes, they're all from different locations, or it looks like they're all from different locations because I can tell that by they're all scattered everywhere, okay? We have 992, 221, 231, 238, 285, okay? So they're all, it looks like different locations, all right? So let's go ahead and document. So A, we have initial hospital. B is a subsequent hospital. So those are different. C is a hospital discharge. And D is an ER visit. So once we determine that, these kind of scenarios are pretty easy because we just have to read what's going on in the scenario. And just based off of the location, we're going to be able to come to an answer rather quickly. Okay, so let me go to my keywords and see what's going on. We have a 33-year-old, and pay attention to my keywords. I don't need very many. So we have a 33-year-old, admitted, that's always a big, huge keyword. Hospital, so we have a patient we know is admitted to the hospital, and here's some dates. We got to pay attention to these dates. 12/17 from the ER. He's discharged from the hospital on 12/20, and provider spends 20 minutes with the patient on the date of discharge. And it's asking us, very important here, to code for that 12/20 visit, okay? Our answer is C, okay? Now, going back again, we're coding for that 12/20 visit. What happened on 12/20? The patient was discharged from the hospital. And these discharge codes do go according to time, but if I look at my answers down here, I'm going to pick the answer that has the hospital discharge in it, which is answer C. So basically, just like that, it gives me my answer. Okay, I'm able to eliminate A, B, and D, and C is my correct answer. So boom, that was pretty easy, right? And great job on that one. All right, let me know if you got it, and we can move on to the next one. All right, Karina. All right, Jeannie, Patricia. All right, I don't see any answers, so we're going to go ahead and move on to the next one. And Miss Josie, do you mind reading this one for us?
Sure, Miss Tracy. And we'll start with the answers first. A is 99203, B 99242, C 99202, and D 99243. A primary care physician has requested Dr. X to see a patient that has been having difficulty grasping objects with her left hand due to decreased range of motion of the ring finger. Dr. X performs a detailed history with an expanded problem focus examination. The patient brought x-rays in, which doctor reviewed, revealing advanced osteoarthritis at the PIP joints of both the left and right ring fingers, giving low complexity of medical decision making. Dr. X recommended the patient follow up with her primary care physician. He will provide a letter to the primary care physician with his recommendation for possible joint replacement. The patient expressed an understanding and will see her back at her request. What E&M service does Dr. X report? And we're going to do 2 minutes and 30 seconds. You may begin. Okay, coders, that's time. Get your answers in. See a lot of good answers in there, a lot of keywords. You guys look like you did pretty good on this one. We're a little bit split. Other than that, I like the keywords in there.
Okay, thank you, Miss Josie. Okay, all right, so looks like the chat is quieting down a little bit here. Okay, so I'm going to look at my answers first here, and the first thing that I recognize is answer A and C. I know those are new office patients, and we have B and D. Those are for office consultations, so those aren't as easily recognizable, but we all, I think, know these 99203 and 202. Those are new patients. So basically, we have 2 from new office and 2 from office consultation. Okay, so those are some things to think about going into the scenario. All right, my keywords, I have primary care physician, requested Dr. X. Dr. X performed a detailed history, an expanded problem-focused exam, and a low complexity medical decision making. And he provides a letter he provides a letter to the doctor. So we're coding here, very important to see who we're coding for, and we are coding for Dr. X, okay? So basically this primary care physician is requesting that Dr. X see this patient, okay? And there's a him that's performed, and he provides a letter. Okay, so those are all very important keywords. Our him is DEL. All right, so basically what are we dealing with here, coders? Are we dealing with a new patient or are we dealing with an office consultation? And how do we know? All right, looks like overwhelming response of office consultation. So how do we know? Yes, that's right, Patricia. Yes, you guys are saying it. You must have 2 R's for these E&M consultations. So we need a request and a report. The request has to come from one physician to another. So that's one thing we need to ask ourselves. And there also has to be a report that's done as well. So those are some things to think about. Okay, our answer is B. All right, so I'm going to document here what we got going on. And again, as you guys are saying, we need 2 R's for those office consultations. And that was fulfilled here because we have a primary care physician that requests the Dr. X. So we have one physician requesting another physician to see this patient. Okay, do we have a report? Yes, we do, because it says he's going to provide a letter, okay, to the primary care physician with his recommendations. So that fulfills both of the R's there. So that means that we're going to be able to code this as an office consult. All right, so we'll get rid of those new office visit codes, focus on what we have left here. Now we need to level. So we'll pull out the him for our answer B there, that's EES, and for answer D, our him is DDL. All right, so out of these 2, B and D, which codes are eligible? Yes, Sarmi, that's correct. Okay, Tiffany, you got it. Yes, Jeannie. Yes, Tina. So both of these are eligible because remember we need to have at least one matching component in order for that to be an eligible code. And we do have that in both of these here. So if we look at answer B, the exam matches exactly to our him in this scenario. And in answer D, the history matches, and so does the MDM. Okay, so those are both eligible codes. Now we need to figure out which one we're going to take. So is this a 2 of 3 or is this a 3 of 3? Because we get to pull out the handy dandy song and follow it according to how many components we need here. Okay, yes, we need a 3 of 3. That is correct. So let's go ahead and pull out our E&M song, and we're going to follow the first part of the E&M song here. New or initial, 3 out of 3. If you select the lowest eligible, and we determine those are both eligible, correct you will be. So we're going to select the lowest eligible out of these codes here, and that's going to be answer B. Okay? So we can get rid of D and take B. All right, so B is our correct answer. So let me know. You got this? If you got it, let me know. All right, Deborah, great job. Great job, Jeannie and Cheryl. Okay, all right. Cheryl number 2. We have 2 Cheryls in here. And they're both M. Cheryl M. So interesting. Okay, all right, so it looks like we got this, and I'm going to move on to our next one. So I hope you're ready for an auditing scenario. The one chart that you're going to need, I don't expect you to use this little one down here, but find this one in your TTT manual and use this. I just wanted to show you here which one I'll be going off of, but this is located in your TTT manual, a lot bigger than what you see on the screen. Okay, and I believe is you for the reading, Miss Kelly, I think.
Yes, ma'am, it is.
All right, thank you.
You're welcome. A 99213, B 99214, C 99215, D 99205. Dr. Murray sees Mr. Burton in his office for nausea, vomiting, and blurred vision. It has been 2 years since his last visit. Dr. Murray performs a history including 4 HPI elements and a complete ROS. Mr. Burton drinks alcohol on occasion and had a heart attack 3 years ago. The exam included 6 body areas. There are 3 presenting problems. The amount of data is moderate, and the overall risk is moderate. He has an elevated blood sugar reading and is diagnosed with diabetes. Mr. Burton is given medicine to control his blood sugar and has a follow-up appointment to see Dr. Simmons in 1 week. What is the appropriate E&M code for this visit? And I'm going to start it with 3 minutes, starting now. Okay, coders, that's time. But I'll probably give it a few more seconds, let everyone get their answers in.
You can put another minute on the clock, Miss Kelly, if you don't mind.
I sure will.
Thank you.
Okay, coders, that's time.
All right, all right. Thank you, Miss Kelly. I think that was time well spent. So, okay, let's see. Guys are doing great on this one. I do see a mixture, but that's okay. We're going to walk through this one together. Seeing some great attempts, and I see some of you that were spot on with this one. I'm seeing some really good keywords here. Like I said, with the auditing scenarios, the keywords are a little bit ridiculous, but we do need a lot of keywords to get to be able to fill out everything in our auditing chart. So let's begin. So first of all, we always want to take a peek at those answers, and A, B, and C, those are all an established office visit. We have 99213, 14, and 15. And then D, that is, I call that the oddball, when we have three that are pretty the same location and then one's not. That's our oddball there. So most likely when we encounter that, that's usually not the correct answer, but let's keep that in the back of our mind when we're going up to our scenarios keywords. All right, so we have Dr. Murray, that's the who. The where, so the location is going to be in the office. Okay, that's good because those are all office visit codes down there. We have nausea, vomiting, and blurred vision. It's been 2 years since this patient's last visit. We have a history that includes 4 HPI elements. We have a complete ROS. This patient drinks alcohol on occasion and had a heart attack 3 years ago. The exam includes 6 body areas. There's 3 presenting problems. The amount of data is moderate. Overall risk is moderate. And he's diagnosed with diabetes. Okay. All right. So basically, what do we do here? What do we need? We know that we have 3 established and we have 1 new. So is this an established based off these keywords? Is this an established or a new? Let me see what y'all are saying. That's right. What lets us know that this is established? Because it doesn't specifically state that this patient is new or established. Yes, the patient was seen 2 years ago. Great job. And if the patient's been seen within the last 3 years, they're considered an established patient, okay? So this patient was seen within that 3 years, so they are going to be considered established. So basically, answer D is going to be incorrect, okay? So we'll go ahead and eliminate answer D right off the bat. We just focus on what we have left. Okay, so we're going to start with our history table here, and we just have this this is just kind of like the simple auditing chart, so we didn't need the more comprehensive one this time. basically our scenario is laying out what we're going to use for our HPI, ROS, and PFISH. So first of all, the HPI, it says there's 4 HPI elements. Okay, so we're going to go to this chart and we're going to circle where it says 4 or more elements under the HPI. So that gives us, that's at a level 3 and a level 4. We're going to circle all that apply. Okay, so there you go. You'll see it out in front of you right there. Complete ROS. So if we go to our ROS to complete, that's 10 or more elements. That falls under a level 4 there. Okay. So there we go. And then our PFISH, how many do we have for the PFISH? Doesn't particularly tell us the number, but we can get it off of our keywords there. Sorry, I'm trying to find my question box. There we go. I keep losing it. All right, so great job, Patricia. I like that. I like that, Sarmi. So you're saying 2 for the PFISH. So PFISH is your past, family, and social history. So it tells us that this patient drinks alcohol on occasion. That's considered part of his social history. And he had a heart attack 3 years ago. That's part of his past history. Okay, so we have 2 elements that were covered here, the social and the history. Okay, so that would be 2 elements for our PFISH. So we're going to circle that, and that falls under a level 2. So if you have 2 to 3 elements, it's a complete PFISH. So that falls under level 4. Now, since all of them are circled, we have to meet in our history table, we have to meet all of the components. So in level 4, everything was met. We had at least 4 or more elements for HPI. We had at least, we had a complete ROS, and we had a complete PFISH. So that means we can code this as a level 4 or a comprehensive history. Okay, so we know the component now for our history, and that is going to be C, or comprehensive. All right, so the next thing we got to figure out is our exam. It says the exam included 6 body areas. So we're going to take 6 body areas. We're going to go over to our table, and that falls under a level 3. Okay, so let's circle that. And that gives us a detailed exam. Okay, so now we have a detailed exam. Now, finally, we got to figure out the MDM. That's the medical decision making. And it tells us in our scenario, we have 3 presenting problems. So for MDM, we have to figure out presenting problems, amount of complexity of data, and the level of risk. So for our problems, we have 3. All right, so let's circle that. All right, that gives us a moderate presenting problems. The amount of data is moderate. Okay, so let's circle that. And the level of risk is moderate. Okay, so let's circle that. So that's all falls in the moderate category. So that is pretty simple. So that means we have an M, moderate MDM. Okay, so now here's our HIM, CDM. We're going to go ahead and jot that down. And then we're going to start figuring out which each one of the HIMs are for these codes. So 99213 is EEL, 99214, DDM, 99215 is CCH. So we just got to determine which codes here are eligible. So tell me which ones are eligible. And if there's any that are not eligible, we can go ahead and throw them out. Okay, I like that, Jeannie. I like that, Patricia. Great answer, Sarmi. Yes, Tina. Yes, Deborah. That's okay, Patricia. Okay, so our eligible codes, remember we have to have at least 1 matching component for it to be eligible. So let's go ahead and take a peek here. All right, so in answer B, our exam and medical decision making, it matches. And in answer C, we have our history that matches, and that's it. So those 2 are both eligible, okay? In answer A, there's nothing that matches to our HIM, okay? See that? So that means that we can go ahead and get rid of answer A, okay? And we just focus on what we have left here. All right, so now we need to level. So what do? Remember, we can pull out the song for this, but we have to first know, is this a 2 of 3 or a 3 of 3? Yes, Patricia. Yes, Sarmi. Yes, Angela. Okay, so this is going to be a 2 out of 3. Okay, so subsequent established. That's the part of the song that we're going to follow. Okay, so that means that we would take, and then also if you look here, that we need 2 of 3, and we have that 2 of 3 that matches right here in answer B, 99214. Okay, so really in this case, we didn't have to pull out the song because this does match exactly. Okay, 2 of 3. That's all we need to meet here in order to code this. So 99214 is going to be the code that we need. So answer B is the correct answer, and let me know if you got it. Great, 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 Haji. I'm glad you got that. Awesome, Deborah, Patricia, Elaine. Okay, all right. So what do you guys think? Not too bad, right? And as the week goes on, by Friday, we're going to be getting into those more comprehensive charts. And unless you guys want it on Wednesday, I might bring in one on Wednesday as well for you guys. I wanted to kind of break in one. Yeah, auditing is a little bit challenging, but once you get the hang of it, you'll be loving it, believe me. I just as Miss Kelly said during those polls that she wasn't very good at auditing. I'm telling you, when I first started auditing, or not even just auditing, but E&M in general, I was just didn't get it because there's so many layers to E&M. But once you start peeling it back and kind of, going through it step by step, it'll all start coming together. That's what these group studies are for. So I want you guys to keep coming to group study. Not only coming, but making sure, you're watching those lectures before you attend. And when you're here, making sure that you really participate, because that's where your speed's going to come from. And that's where your level of understanding is going to start improving as well. Okay, you'll have those aha moments. So just keep on attending. And if it's hard and challenging for you right now, that's okay. It's supposed to be. Okay, if you knew it all, you wouldn't be here. So as long as you're learning something, that's what matters. So that's all I'm going to say about that. Okay, so great job, everyone, on this. And we are going to move on to our next one. And Miss Josie, can you read this one for us, please?
I sure will, Miss Tracy. Let me size this so I can read the whole thing. Okay, we're going to start with the answers first. A is 99214, 99356. B, 99214, 99358. C, 99203, 99354. D, 99203, 99358. A 41-year-old patient is being seen for the first time by the physician for a risk reduction mastectomy for her BRCA1 positive status. The physician performs detailed history and exam with the low complexity medical decision making. The physician spends an additional hour discussing breast reconstruction options, tissue expander options, and the benefits of quitting smoking due to the risk of infections and/or complications of surgery. How is this visit reported? I'm actually going to do you want to do 3 minutes, Miss Tracy?
Sure, that'll be fine, Miss Josie.
We'll do
Thank
3
you.
minutes. You may begin now. Okay, coders, time's up. How you guys doing in there? See a lot of good answers. We could have put some keywords in here. I see some keywords from some of the coders, Miss Tracy. We're pretty much split up between C's and D's.
Okay. All right. Well, we're in the right direction. Thank you, Miss Josie. So yes, we are on the right path here. And I think when we go through this, you're going to see your mistake, and I'm going to give you a little advice, a little tip to notate in your book so you don't make that mistake again. Okay. All right. So let's go ahead and take a peek here at what's going on. Now I see 2 codes that are listed here. Remember, 1 E&M code per doctor per day, except for PICS. It's a pretty good indication this is a PICS because they all have 2 E&M codes. So we don't really have to worry about sorting that out. But the other thing that I noticed is that there's A and B is for an established office, the first listed code there. And C and D is for a new office, okay? So I have to figure out, is this a new or an established patient? It's gonna be very important going into this. And then these second listed codes here, that is our prolonged service code. And yes, those are part of our PICS. So that means when appropriate, we can code another E&M code, another E&M visit with it, okay? All right, so let's go to the keywords. We have a 41-year-old, first time, okay? Major keyword there. What does that mean? First time. Okay, so we have physician, risk reduction mastectomy, BRCA1 positive status, the physician, detailed history and exam, and low complexity MDM. So there's our HIM. Physician spends an additional hour. Okay, so those are all the keywords that I have. Now I'm going to document my HIM because I know it. It's DDL. Okay, whether I use it or not, that's, you know, we still always want to make sure we get in the habit of knowing what our HIM is. Okay, so is this a new or an established patient? Yes, that is right. You guys are answering new. Yes, it's new because this patient's here for the first time, okay? That indicates the patient is new. So we can go ahead just like that and we can get rid of A and B, okay? So I love when I can eliminate 2 answers right off the bat. It makes my job a lot easier and it helps me get to that correct answer quickly, and that's what we need on the test because the exam, like you guys were saying at the beginning, I saw some of you saying, yeah, that the ones that have taken that exam before, that time does go very quickly. 5 hours and 40 minutes seems like a long time, but really, when it comes down to it, it's not. You have about 2, that's why we give you, if you don't know where the time comes into play, we give you about 2 to 2.5 minutes to solve these scenarios. We try to stay within that range because on the exam, that's all the time you really have to answer each scenario. So you're getting in the habit of working on your time. And if at first that time seems to go by too quickly for you, keep coming to group study. That's what this practice is for. You'll see over time you're going to improve that. And we're going to show you little tips on how to improve that time as well. And this is one of them. We can eliminate this right off the bat, okay? Because we know based off our keyword, this was the patient's first time visit, okay? So therefore they're not established and we're not going to use those established codes. Okay, so 99203, I don't have to do anything with that HIM there for these office visits because it's the same code and I know this is a new visit, so I don't have to worry about the HIM, although I did document it because it's good to get in the habit of that. All right, so what is the difference between 99354 and 99358? Those are for the prolonged service, and this is a prolonged service. Additional hour right there, you might just want to jot down next to your prolonged service heading that this is a keyword to look for when you're dealing with prolonged service. Okay, if it's saying additional hour, that is a prolonged service. Okay, all right. So what is the difference between C and D? Let me know if you guys spotted it. Yes, that's right, Patricia. Yes, Sarmi. Okay, yes, it is an add-on code. Great observation there. But the biggest difference you're going to find in the red headings. Okay, so if you look on page 32, let me just make sure I have my 2019. Yes, I do. I've made the mistake sometimes of getting the the older version. But anyways, okay, so on page 32, that's where your prolonged service starts. It shows it in the green heading up there at the top. Right underneath that, in the red bold, it says prolonged service with direct patient contact. And then if you go to page 33, which is where the other code is listed, 99358, under that red heading, it says prolonged service without direct patient contact. So the difference here between these two these two red subheadings is either with direct patient contact or without. So the tip that I'm going to give you is to put a box around with on page 32 and put a box around without on page 33. Okay, that makes a world of difference because I know that I got something similar to this wrong because of that, because I wasn't paying attention to that. And it is easy to do, because you're just reading at the code level what it's saying, but you really have to trace back to what the subheading and the heading is saying to you as well. Okay? Perfect. Great job, Deborah. Great to hear that. Okay, so now that we've determined that, is this with or without patient contact? That's right, it's with patient contact. So we're going to use the code for with patient contact, okay? And that means answer C is going to be the correct answer, okay? All right. Let me know what you're thinking. Did you get this? If you did, just tell me you got it. If you have any questions, let me know. All right, I'm seeing got it. Okay, perfect. Looks like we got this one, so I think we're safe to move on. But just adding those little notations in there really does help, okay? Perfect. Okay, so I'm going to move on to the next one. And Miss Kelly, can you read this one for us, please?
Of course. A 99284, B 99475, C 99476, D 99291. A 3-year-old critically ill child is admitted to the PICU from the ER with respiratory failure due to an exacerbation of asthma not manageable in the ER. The provider starts continuous bronchodilator therapy and pharmacologic support along with cardiovascular monitoring and possible mechanical ventilation support. The provider documents a comprehensive history and exam, and orders are written after treatment is initiated. What CPT code is for this encounter? And you have 2.5 minutes starting now. Okay, that's time, coders.
Thank you, Miss Kelly. And Miss Kelly, I want to take this time to tell you thank you. Miss Kelly has a long night, coder, so she's going to be leaving us. Thank you, Miss Kelly, so much for joining us tonight, and get some sleep.
Thank you. Thank you, everyone, for having me tonight, and looking forward to seeing everyone on Wednesday.
All right. We'll see you on Wednesday, Miss Kelly.
Good night.
Good night. Okay. All right. Yeah, Miss Kelly has to leave because she actually works. She's a very hard worker. She has to go back and do a double shift tonight at work. So she's already worked her one shift, and she needs to get some sleep before she goes in for her second shift. So we'll miss her, but we'll see her back here on Wednesday. All right. So let's see, everybody. Everybody's telling you goodbye, Miss Kelly. Okay. I see a lot of you got this correct. So this makes me happy. I like this. And if you didn't get it correct, that's okay. We are going to walk through it together. All right, so first of all, looking at my answers, I noticed A is my oddball here because that's for an emergency room visit, and the rest of these are critical care codes, okay? So that's what we need to think about going into this scenario. All right, so we have, I'm going to document that. Our keywords are 3-year-old. So basically, anytime we see an age, we always have to make sure that we include it as part of our keyword, okay? Some of these codes are age-driven, and whether they are or they're not, just get in the habit of always including the age as your keyword. All right, critically ill child. I like that. We have some critical care codes. Admitted. PICU from the ER. Okay, so this patient was admitted from the ER into the PICU, and we have a comprehensive history and exam. That's our HIM. We don't know the medical decision making, but I'm going to document what I have so far. Okay, just in case I need it. But we have CC, and we don't know the MDM, but that's okay. Now, tell me, coders, am I going to code an ER or am I going to code critical care? Yes, we're going to code this as a critical care. Great job. So basically our little oddball right there, we're going to go ahead and get rid of it. That emergency room visit, we're going to get rid of it. We're dealing with a critically ill child, okay? All right, so that leads me to ask you, when we're dealing with critical care codes, what do we have to ask ourselves? There's two main things I always say that we need to ask ourselves when we're dealing with critical care. What's one of them? Yes, Jeannie, you got it. Okay, I'm seeing age of patient, I'm seeing time, I'm seeing inpatient or outpatient. I like that, Patricia. I like that, Deborah. Okay, so the two main things we need to ask, first of all, what is the age of the patient? And second of all, is this patient inpatient or outpatient? And depending on what set of critical care codes we're going to use, then yes, time would come into play, but we only use time for the 99291, 99292, okay? So the first question, how old is the patient? Well, we know the patient is 3 years old. So if they're under 5 years old, there's a certain set of critical care codes that we can use, but only if they're inpatient. So that brings us to our second question. Are they inpatient or outpatient? Okay, so is this patient inpatient or are they outpatient? Yes, they are inpatient because it says this patient was admitted. So that's why that's a really big keyword right there. All right, so if the patient is 3 years old and they're admitted, that means we don't use this 99291 because that 99291 is only used for younger patients if they're outpatient. So if they are not an outpatient, we do not use the 99291 code, okay? So if you want to jot that down, in your nice new 2019 book, 99291 is on page, I believe 25. Yeah, page 25. You can write that there, not for younger patients unless outpatient, so that you don't make the mistake of coding this when we're not supposed to, okay? So because this patient is under the age of 5 years old and they were admitted, there's another set of codes that we're going to use for this patient. Okay, so 99475 and 99476, those are for the inpatient critical care for a younger child, and this basically is going to be either whether they're initial or subsequent. Okay, the difference between B and C is whether they're initial or they're subsequent. Okay, so that's the right age, between 2 to 5 years old. But again, is this an initial or is this a subsequent? So let me see what you all are saying in here. Okay, looks like so far it's unanimous that this is an initial critical care for this patient, and that's correct. So we can go ahead and get rid of answer C, and that makes B the correct answer. So great job on that one. And it looks like we got pretty close to 100% on that one. So it looks like you have a pretty good understanding of these critical care codes. And on Wednesday, we're going to be getting a little bit more into these critical care codes as well. Okay? So if you haven't watched all those lectures, you have a couple days to do it. I'm telling you, it's worth every second to watch those lectures. And even though we have some new ones coming out, still watch the old ones and you can compare them to the new ones. The new ones are going to have a lot of the same material, but just really honing in and providing a lot better understanding. Mrs. J is always raising the bar, so I'm really excited to see those new lectures. I can't wait. All right, great, Patricia, sounds good. Yes, you guys are AMCI proud. Yes, you are. Really, Deborah? That's awesome. You could have fooled me. You did great tonight. So I think you like E&M a little bit more than you think. Yes, Patricia. Okay, so looks like that is time. If you guys have any questions at this time, I'm going to stick around and answer them for you. And if I know that a couple of you wanted me to go back so you could screenshot something, just let me know what you wanted to screenshot, and I'll be happy to go back for you guys. Thank you, Cheryl. Have a great night. And if you guys are finished and you are heading out, I want to tell you good night. I hope you guys learned something tonight. I hope you enjoyed tonight's class. Please let me know what you think in the survey. I love to hear from you guys. I always look forward to reading all your responses. So any suggestions, an aha moment you had, anything you want to share with me, please do. Good night, Deborah. Okay. And Miss Josie, if you want to come to the floor, if you have anything to say, or if I may have missed a question or something, let me know, because sometimes they slip past me.
I think everybody did really well tonight, considering some people said they didn't like E&M that much. I mean, it was definitely difficult for me, but the more I do it, the more I understand it, and I was doing them right along with you guys. So I didn't look at the answers tonight, Miss Tracy. I was doing them as well. So, because it's good review for me.
That's fantastic, Miss Josie.
They did really good.
Yes,
so I don't see a lot of changes in this year's books. I don't see hardly any changes for E&M. Do you, Miss Tracy?
No, there's some at the back of the book that I noticed that there is some new codes for some of the care managements, I think. So, just pay attention to those red dots. You'll see some of those at the very back, and then there's some revised text and stuff, and you can see that by the green. And sometimes there might just be one word or one code that was changed, and even if it's just one word or one code, they'll put it all in green to revise that text. So you might sometimes I'll go through my 2018 and then just kind of see what was different. I think something in critical care, they might have added or or taken out one of the codes for on page 24, you'll see some green text there. So just be mindful of that kind of stuff. But yeah, you're right, Miss Josie. For the most part, E&M stays pretty standard, I think, with the codes, and especially the ones we use a lot, like the office visits and the ER and the inpatient and all those ones we use quite a bit. Okay. Let's see here. I don't see anyone who's asking me to go back, so maybe I think someone wanted me to go back for that location chart, but I know I showed it again later on, so you probably got it there. I don't see any other questions.
I don't see any either, but all those charts are in your TTT manual, and you can copy them or you can download them. All very helpful. I've made several copies, and I just put them in a clear folder, and I use pencil, and then I erase them so I don't have to make a whole bunch of them.
Yeah, nice. Good idea. All right. Well, Miss Josie, I want to thank you so much always for your help. You're always willing to come in and help us out, and I really do appreciate that. So thank you, Miss Josie.
You're welcome. It's my pleasure, coders. I enjoy being here with you, and like I said, I'm learning right along with the coders, so we're all learning together.
Yes, yes, we are. I'm learning too. I'm telling you, no matter how many times I do this, I always learn something, whether I'm going through my book or I'm watching a lecture. It's coding as always. You just have to, keep up on it, keep practicing. And there's so much always to know and to learn. So I'm glad you all came tonight. I hope to see you back here on Wednesday. So we'll do some more E&M coding on Wednesday. And enjoy the rest of your night. And thank you, Miss Josie, again. Have a great night.
Thanks.
Good night.
Good night, coders. Good night, Miss Tracy.
Good night. Good night, coders.